case number 4. An 8-year-old child with asthma presents with an increase in coughing and wheezing symptoms. The parents note that these symptoms seem to occur every year during the spring season. The child also has a history of allergic rhinitis and eczema. What is the most likely cause of the seasonal exacerbation of this child's asthma symptoms? A. Exposure to cold air. B. Seasonal allergens. C. School environment. D. Indoor mode exposure. Correct answer B. The child's symptoms worsening during the spring, a common time for pollen allergies, along with a history of allergic rhinitis and eczema, suggest that seasonal allergens are likely contributing to the asthma exacerbations. Trees and other plants pollinate in the spring, causing an increase in symptoms for those with pollen allergies.